Madam Au has heart failure, which means that her heart is not pumping blood to the rest of her body as well as it should. Madam Au, however, is able to lead a normal active life. She is able to do so because she has learned to take good care of herself. Most important things Madam Au does to cope with heart failure is to stay active. Not only does being active make patients feel better, it may decrease the symptoms of heart failure and improve one's heart function. Madam Au uses two methods to relieve her symptom of breathlessness when it happens. For the pursed lip breathing technique, she first shapes her lips as though she is blowing a candle. Then, she blows out slowly through her pursed lips for 2 to 3 seconds. The pursed lip technique can be used if you feel short of breath at rest or during activity. There is another way to ease Madam Au's breathlessness. She can lean forward while seated or standing, or she can lean her back against the wall while standing. As advised by her doctor, Madam Au always plans ahead for her day, as some tasks may increase the demand on her heart and cause her to develop symptoms. To plan ahead, identify the easier activities. Spread out the activities and alternate easy tasks with harder ones. Do not rush and take enough breaks in between activities. Do not stay up late at night. Madam Au will need to check with her doctor or physiotherapist first if she wishes to start on a new activity. There are some activities that will make the heart work harder and should be avoided. Therefore, heart failure patients like Madam Au should avoid lifting and carrying items which weigh more than 5 kilograms. Avoid heavy housework such as vacuum cleaning, mopping, cleaning the bathroom, and doing heavy laundry. Avoid climbing more than 3 stories of stairs at a time. Avoid slopes and overhead bridges as much as possible. Avoid engaging in vigorous activity. Sit down during activities like bathing, dressing, and cooking. Walk slowly and take frequent breaks during a long journey. Wherever possible, use a trolley to transport heavy items. Store frequently used items such as cups, plates, and bowls in easy-to-reach places. If the lift does not stop at her destination level, Madam Au should take the lift to a higher level and walk down the stairs. Use the escalator whenever possible. Now that you've seen what heart failure patients like Madam Au can and cannot do, let's move on to see how exercise can help you. From taking medication and changing your diet, exercise is another important therapy that can help to improve your symptoms and prevent or slow down the progress of heart disease. A good exercise program can also prevent further injury to your heart. Benefits of exercise include stamina, reduced shortness of breath, reduced symptoms of fatigue, improved muscle tone and strength, improved balance and joint flexibility, lower blood pressure, loss of body fat and body weight. Every exercise session should include 3 phases, which are the warm-up, conditioning, and cool-down phases. The phase is the first phase of your exercise session, and it usually takes 5 to 10 minutes. Warming prepares your body for exercise while reducing the risk of injury to your muscles and joints. The hand exercises and stretches during a warm-up will gradually increase the workload on the heart and reduces the risk of developing chest pain and abnormal heart rhythm. The conditioning phase is where you perform the actual exercise, usually for 10 to 30 minutes. This includes aerobic exercises such as walking, cycling, swimming, or jogging. After your discharge from hospital, Start off slowly and gradually increase your exercise time as you progress. Lying down for 5 to 10 minutes allows your body to recover from the conditioning phase. This prevents blood from pooling in the legs, as well as muscle soreness and tightness. Walk or do some stretching to return your heart rate and blood pressure to resting levels after the cool down. To get the best results from your exercise, remember to stay fit, which stands for frequency, intensity, and time of your exercises. Ideal to exercise about 1 hour per day on most days of the week. There are 4 ways to gauge the intensity of your exercise. And you can do this by monitoring your symptoms, breathing, pulse rate, and using the rate of perceived exertion scale. Feel comfortable while exercising. There should not be any pain or discomfort. Stop all exercise if you experience any symptoms such as chest pain, giddiness, difficulty in breathing, and excessive cold sweat. It's normal to breathe faster and harder during exercise, but your breathing will become increasingly difficult when you exercise too hard. By exercising at the correct intensity, you are able to slowly count from 1 to 15 without stopping more than 2 times to catch your breath. Resting pulse rate, or RPR, rate at which your heart beats while you are resting. To measure your RPR, put 2 fingers on your pulse near your wrist. Count the number of beats within 10 seconds. Multiply this number by 6 to get your RPR. When exercising, your pulse rate should only exceed your RPR by a maximum of 20 beats. For example, if RPR is 80 beats per minute, your exercise pulse rate should be less than 100 beats per minute. You are advised to take your pulse before your warm-up, at regular intervals during your walk, 5 minutes after cooling down. The rate of perceived exertion scale is used to gauge if you are exercising at the right intensity. The desired range during exercise is between 11 and 13 on the scale. You should feel that you are exerting yourself fairly lightly or somewhat hard. Exercises such as walking, cycling, swimming, and jogging are recommended as they help to improve the stamina of your heart and muscles. What is the easiest exercise for you at this point in time? You should consult your doctor before you start on any form of strenuous exercise. Time refers to the duration of your conditioning phase. You gradually increase your exercise duration from 20 minutes to 60 minutes as advised by your doctor and physiotherapist. Here are some pointers on exercising for diabetic patients. As your body burns more sugar to give you energy during exercise, the combined effects of physical exertion and diabetic medication may lower your blood sugar level during and after exercise. Sugar level is lower than the recommended range. Eat a piece of fruit before you exercise. Do not exercise if your level is above the recommended range. Diabetic patients must stop exercising if they experience any symptoms related to low blood sugar. Low blood sugar levels may occur at any time during exercise. It's good practice for diabetic patients to always carry a carbohydrate snack with them, just a piece of fruit. Those who do not have a glucometer to check their blood sugar level may exercise 2 hours after a meal to be safe. Diabetic patients may also consume a meal rich in carbohydrates after their exercise to replenish their blood sugar level. Now, let's get started on the exercises. You can perform these exercises at home based on the advice from your physiotherapist or doctor. Remember to take your resting pulse rate before and after you exercise. Remember to check your blood sugar level before and after you exercise if you are diabetic. Shoulder shrugs. Move your shoulders up and down 5 to 10 times. Shoulder rotation. With hands on your shoulders, draw big circles with your elbows 5 to 10 times. Shoulder flexion. Raise your right hand and put it down 5 to 10 times. Repeat with your left hand. Elbow flexion. Bend and straighten your arms 5 to 10 times. Trunk rotation. Feet apart, turn your trunk to reach across your body for both sides 5 to 10 times. Trunk side flexion. With feet apart, bend your trunk to the left, then right, and repeat 5 to 10 times. Calf stretch. Put your right foot forward, bend your right knee, keeping your left knee straight, and hold for 5 seconds. Do not put one foot directly in front of the other. Repeat for the other side. Inner thigh stretch. Stand with your feet apart and bend your right knee. Keep your left knee straight. Do not turn your body and hold for 5 seconds. Repeat for the other side. Front thigh stretch. Hold your right ankle and hold for 5 seconds. Ensure that your knees are pointing to the ground. You may hold on to a stable surface for support. Release and repeat for the left side. March on the spot. Support yourself with one hand on a sturdy structure to your side. March on the spot for 5 to 10 seconds. To stand exercise. Place your palms on your knees and gently push yourself into a standing position. Sit back down and repeat 5 times. Knee extension. Straighten and bend your right leg and then your left. Repeat 5 times. Heel raises. Hold on to a sturdy structure for support. Tiptoe and lower your heels to the ground. Repeat 5 times. Hip abduction exercise. Support yourself with one hand on a sturdy structure to your side. Raise your right leg to the side, lower it back down, and repeat 5 times. Turn around and do the same for the left leg. Please approach your physiotherapist or doctor if you have any questions.